Most ovarian cancer, even when advanced, responds well to treatment.
Generally, a gynecological oncologist is someone who's originally started doing general obstetrics and gynecology training, which is a 6-year training program, and then subsequent to that they do a further 3 years of training in gynecological cancer surgery as a specialty. And at the end of that time they then sit exams and are fully qualified to manage women who are diagnosed with gynecological cancers, particularly ovarian cancers.
Chemotherapy can be given in multiple ways. The most common way for chemotherapy to be given is through an intravenous drip into the hand or the arm, or into a port that's in the chest. Chemotherapy is usually given in a hospital, in a chemotherapy unit. That unit will be decided by the oncologist that is treating, so wherever the oncologist is registered with particular hospitals, that's where the chemotherapy will be given. A chemotherapy regime usually lasts for about 6 months. It's given in 3 weekly intervals. That tends to be the most common way and time frame for chemotherapy to be given, but it's also very dependent on the drugs being used.
It's not difficult while you're sitting there getting the drug into you. You feel a bit strange, but it's not too bad. Afterwards you feel quite sick, but it's not unbearable. It's not something that you just can't do. It's okay. It's tough, but it's not impossible.
There are some more ways that chemotherapy can be given, and that's usually either through the intraperitoneal cavity via a catheter, or it can be done with oral chemotherapy tablets, although that's quite uncommon these days. Most common side effects for a woman undergoing chemotherapy are things like nausea and vomiting, although these can be managed quite well with anti-nausea medication dispensed by a pharmacist and prescribed by the oncologist. There's also some fatigue that is to be expected. There's some lethargy as well, although the two kind of go hand in hand. Trouble with diet and nutrition, may not feel like eating, although that again can be managed with the help of a dietitian.
The chemotherapy is very difficult, painful. You feel nausea, you feel concern. But the thing that is the hardest, which surprised me, is losing your hair. And you know it's going to grow back, but it just devastates you. It's humiliating. It's denigrating to have no hair. It's such a label. Everyone knows that you've got cancer. And so I was surprised how difficult that was to deal with, considering I knew that my hair would grow back. And I also had a wig, which everyone thought looked much better than my hair most of the time anyway.
Chemo ain't for sissies. The first week, it's difficult to sleep. Everything is awful. But the second week, you actually feel okay.
So when you're going through your treatment, it's really important to do a journal or a diary of what's going on, and there's a great one in the Resilience Guide.
One of the big things for me when I was diagnosed with ovarian cancer, I had 3 operations and lots of chemotherapy, meant that my greatest fear was that I probably wouldn't be able to be a mum. We explored lots of different ways that we could potentially have a baby after cancer, or at least look at options to freeze eggs and all those sorts of things that are available. And unfortunately for me, my cancer was so aggressive and so advanced that they weren't available to me. So I had to live with the fear of just getting operated on, having my chemotherapy, and live with whatever the consequences were. As a minor medical miracle, we embarked on IVF, knowing that it would probably be an extraordinarily long road for us, and we've recently welcomed into the world our baby girl.
Clinical trials are extraordinarily important, particularly in ovarian cancer. One of the problems we have is that overall ovarian cancer is relatively rare, and therefore the experience we have is difficult to generalise. So all studies that are done on ovarian cancer require input from many different centres to recruit people into trials to ask questions about how ovarian cancer should best be managed.
But it also means that you're forwarding the prospect of people down the line maybe finding a cure from this, that you might be able to help your daughter and your daughter's daughters. And this is a wonderful thing to do, because obviously we have to move this forward. We have to do more on research, and it's great to be a part of that.
there is some evidence to suggest that women who are involved in clinical trials actually do better, whether they receive the trial drug or whether they actually receive a placebo in the same trial. The overall benefit is that their outcome is better and they appear to live longer